For my 5-minute hot topic, I'm going to talk to you about eating healthy with diabetes, and I'm going to use a method called the plate method to help you understand that. My name is Abby Gold. I am the Nutrition and Wellness Specialist for the University of Minnesota Extension and North Dakota State University Extension Service. And I work with a program in North Dakota called Dining with Diabetes North Dakota Style. In the lesson that kind of focuses in on heart health, we really do try to stress the importance of blood glucose control through diet, exercise, and medications if necessary. And adopting a heart-healthy eating pattern, preventing long-term complications, and understanding the role of blood glucose control is really the purpose of the Dining with Diabetes program. So the next slide I'm going to show you is going to look very familiar to you, and that is the plate method. The plate method is sort of a really great way of visualizing the types of foods that people with diabetes should have and how to kind of organize their plate. And lo and behold, it looks very familiar. But it is a little different than the one that we use, myplate.gov. It is a little different, and you probably noticed that with this plate method, and it's actually called the Idaho plate method, half of the plate is vegetables, a quarter of the plate is whole grains, and a quarter of the plate is meat, beans, or like nuts or seeds. And beans can also count as a starchy vegetable, as you know. But and then you have your milk and your fruit. Now, let me ask you this. Can you identify which foods on this plate have carbohydrates in them? Because carbohydrates are the foods that you probably all know will raise somebody's blood sugars or blood glucose levels. So those are the ones of most concern, at least for somebody who is trying to control their blood sugar levels. And so the foods on this plate that have blood sugar in them are whole grains, fruits, milk, and some of the vegetables, especially starchy vegetables. This next slide is a chart of food groups containing carbohydrate and their serving size. So grains, 1 slice of bread, half a cup of cooked pasta, cereal, or rice, and half a cup of potato, corn, peas, and beans. And as you see here, the starchy vegetables like potato, corns, peas, and beans will go into the whole grain category, but don't make good substitutions for whole grains actually. The fruits, the portion or serving sizes are 1 small piece, a half a cup cut up, 2 tablespoons of dried, or half a cup or 100% juice. Milk is 1 cup of liquid milk or 1 cup of yogurt. And then the vegetables, concentrating in on the low carbohydrate vegetables, are green beans, beets, broccoli, carrots, cauliflowers, tomatoes, spinach, and a half cup cooked is what fits into the plate, or 1 cup raw. Now, I usually suggest to people that they would eat, for the vegetables, 2 different types of vegetables. Maybe they would have a salad and then another type of non-starchy vegetable to go on that plate, and that would make up half the plate. So that is the plate method, and it's pretty simple. And when I worked at Family Healthcare Center in Fargo as the dietitian, I would have like a half sheet handout that I would give to my patients, and I would hand this to them, and we would start the conversation from there, setting goals and trying to help people incorporate some of these healthy foods, and trying to keep it really simple as well. And because if you keep it simple, you get a better understanding of where things fit on your plate. Another concept that is important for people with diabetes to understand is that foods with carbohydrates, they're going to all have if they're equivalent to each other, they're going to have the same effect on blood sugars. So one starch equals one fruit equals one milk. And so if you have two pieces of fruit, that would be two starches or two milks. And it's just knowing how much carbohydrate you need to eat in the day. And there's a formula for figuring that out. And then understanding how many servings of fruit or how many servings of carbohydrate to have in a day, and then splitting that out into your day. And then it's all interchangeable, and keeping track is also very important, at least at first for people, so they can get an understanding of how things work, and then they can be more habitual about it eventually. What about dessert? Dessert's something that people really love. They don't want to give it up. And really, people with diabetes don't have to give it up. It's just understanding what these foods are equivalent to. So if you have a cupcake, to know that's probably going to be equal to two pieces of fruit. And so you're really going to have to think about, do I want to eat this? And then have to not eat other things during the day because I've eaten the cupcake. It's just a matter of substituting and knowing what the equivalents are. And Weight Watchers operates very similar to this with their point system. And so the plate method is just pretty easy to understand, and it's a good place to start with people who have diabetes. And so since I only had 5 minutes to talk to you, there's so much more to know about diabetes and nutrition and physical activity and medication and all of the things that go into helping people control their diabetes. Maybe I piqued your interest into learning more about the plate method and how it might be a little bit different than my plate, and understanding a little bit more about how carbohydrates affect blood sugars, and that one carbohydrate is equal to another type of carbohydrate is equal to another type of carbohydrate, and so on. It's all about understanding that these equivalents will have the same type of effect on our blood sugar. Then and once you get that down, it becomes a lot easier to manage your blood sugars. So I'm happy to answer any questions, and you see my email address on this slide there. And you can also reach me at NDSU. You can look up my name on Google. I'm there, NDSU and University of Minnesota. And I am so happy to have had this opportunity to talk to you about the plate method and diabetes.